Excellent. We haven't always done that perfectly well. So. All right, I'm going to give you this. I wish you would hang.
Well, it really is. Been mentioning a little earlier. This is a new way of delivering primary care-based services, and again, so much more. So within the primary care setting, we have truly integrated behavioral health services, nutrition services, care coordination services. So it's more than just coming in and seeing your provider. Yes, you're going to come in and see your provider, but so much more is right here when you need it, and really creating that one-stop shop type environment. Now, connected to this, of course, is the existing RAW Pavilion, which has all the referred services you might need if you need an x-ray, if you need lab work, all right here attached to the same facility. And very soon we'll have a retail pharmacy located right in this building that'll be not only for our patients here, but for the community as well with the drive-through feature. So very exciting development in how we deliver services at St. Mary's. Well, first I think we have to start with thanking the Rao family. Dr. and Mrs. Rao have just been tremendous supporters of St. Mary's and our community in general. Without them, of course, this again wouldn't be happening to the extent it is. So very much appreciate them. This is all, of course, made possible too through a grant through New York State. So we have to really thank the Department of Health of New York State for recognizing the value of creating these integrated services. We have this facility. We're also going to have a brand new inpatient chemical dependency program over in the Memorial Tower. So again, want to just also recognize the state for providing inspiration also for these new service lines. Well, a huge issue that we're dealing with and many communities are dealing with around the country are access to mental health services. Having those located right here, I can't stress enough how critical that is. Not only are we going to be able to provide those services as we've done, we're going to be able to provide it in a setting where we know patients are coming for their primary care needs anyway. So having that coordinated together, I think, is really the cornerstone of this project. Now, supplementing that with those other services, nutrition support right here, working together with your primary care provider, critical, and then care coordination. As streamlined as we want to try to make our systems, you need help often with navigating the healthcare system. Having those support staff right here in this facility is going to go a long way to creating a better experience for our patients and delivering on the promise of delivering better care for lower cost and higher quality. So this actually started when my predecessor, Vic Giulianelli, was CEO. So this goes back quite a ways in terms of the planning for it. We mentioned that we had our groundbreaking in October of 2020. There was probably 12 to 18 months of planning in advance of that and working with our partners in this, BBL, and the architects involved. All the staff and leadership and providers of services here at St. Mary's, they were all very much involved with the planning of the facility and creating the experience that we're going to deliver for our patients. So I think a lot of times patients have been, over the last year or more, reluctant to come in and see their healthcare provider. We've tried to meet that need through telehealth services, which we continue to offer. But at this point, we know patients are anxious to get back and see their provider. So having this accessible facility with so many other things right here, I think is going to be a perfect way to kind of mark, we're not at the end, but we're getting close, and we're welcoming patients back into our facilities, and what a great way to do so.
After to get a quick tour?
Sure.
You want a few minutes after to get a quick tour of the place? Oh yeah, sure. Okay. Hello, how are you, Dr. Rao? Good to see you. How are you? Good to see you. Good to see you, Dr. Rao. Thank you for coming.